Well, thank you so much, Jerry, and thank you to all of you. It's a real pleasure and an honor to be here again, speaking to all of you here at the IHI Forum. I have to say thank you, Jerry, and thank you to all of my colleagues on the IHI Board of Directors for trusting me to lead this amazing, incredible community, as Jerry mentioned, over the past 5 years. It's been an absolute pleasure. It's been an honor to serve IHI's mission and its purpose and its community alongside the amazing, incredible, talented, gracious staff who are filling these hallways and the amazing faculty who are teaching in these rooms of this incredible, wonderful organization. And thank you to every member of the IHI community, all of you, for making the past 15 years of my life so incredibly special to me. And welcome to every one of you to the 36th Annual IHI Forum. I'm so incredibly glad that you're here. I want to start today in this final keynote, as Jerry mentioned, by introducing you to someone who is both very special to me and a little notorious, actually, at IHI. This is my son. This is Bodhi, my middle child. Some of you have met Bodhi before. He's 11 now and in the 5th grade. And for years at the IHI Staff Talent Show, he would do whatever he could to show me up. He would routinely demonstrate to the staff how he could pretty much outdo me at everything that you could put your hands on, at playing chess, at solving a Rubik's Cube, whatever it was. Bodhi was out to prove me inadequate. I think of Bodhi mostly this way these days. Unfortunately, I see the back of his head most of the time. Much to my chagrin. He's sitting in front of the computer, solving math problems or playing video games or coding something. But he's also up to almost anything with me and with his mother and his siblings. Hiking, skiing, playing soccer in the yard, baking cookies with his mother. Bodhi is, in many ways, a utility player for us in our family. He's the first one up in the morning, of all of us. He's the first one up, and the first one in my bed in the morning for his daily snuggle. It's very cute. I don't know if I'll ever get over that. I think it's something I hope he continues forever. I know he won't. Yeah, right. I have to wait for his kids, right? True. As Bodhi gets older and has gotten older, he has started to develop some issues. Issues with anxiety, issues with anger, and that anger has started to border on rage in some cases. And he unfortunately started expressing that physically at home with his siblings and even with my wife and I. Earlier this year, actually, on the same exact day, we got 2 alarming phone calls from both his teacher in school and his after-school teacher, his after-school coach. Bodhi was no longer being a good teammate and a good classmate. Our sweet kid was starting to earn a reputation as a troublemaker. This was so far beyond Bodhi, so far beyond the norms in our home, that my wife and I honestly really didn't know what to do. We were struggling to understand how to help him. We tried the usual, I'm sure misguided things: boundary setting, discipline, encouraging more sleep, deep breaths, squeezing lemons. We were trying everything here. Get a therapist, we did that too. But nothing actually seemed to be working for him, and Bodhi, sensing trouble, started to withdraw from all of us, challenging the social fabric of our home and his community in school. I remember getting those calls from school while I was traveling. That's where I get all my calls these days. When I was traveling at a conference, not unlike this one. I was sitting next to a good friend of mine, and I guess when I got the call, I must have given off an audible sigh. And she asked me what was up, what was troubling me. And I told her about Bodhi and what I was dealing with, what he was dealing with. She'd had some similar challenges with her own children, and nerdy healthcare people that we are, she shared an article with me, of course. At least this article was from the New York Times. The article referenced a single, simple question. Do you want to be helped, heard, or hugged? Some of you, I hope, have seen this article. At different points when we struggle in our lives, we want different things. Different people want different things. The same person can want different things at different times. Or a person can want or prefer a solution consistently. I, for example, am a problem solver, as Jerry mentioned, so I like being helped. That's my thing. I'm consistent in that. Sometimes, most times, as my wife frequently reminds me, she doesn't want fixes or solutions. She just wants to be heard. The same is true, of course, of our profession and our patients. My wife is a palliative care doctor, and many years ago she taught me something that has perhaps been one of the most important things that I've ever learned in the practice of medicine. Never follow feelings with facts. Never follow feelings with facts, she told me one day, as I was dealing with a challenging family situation. When we deliver good or bad news, a life-threatening diagnosis, a horrible prognosis, a difficult choice, we tend to move quickly from great emotion to a deluge of information, a deluge of facts. The pathology showed X. We'll do another scan in 3 weeks. Do you want to be intubated? Knowing my propensity for following feelings with facts, she told me, please try not to do that. Stay, if you can, with the emotion. Stay with the emotion. Go where the patient wants to go, where they need to go. That's where you build relationship. A few days later, I was home. Bodhi's brother was picking on him. There was a fight over an iPad. The shoving was starting, and I could sense the anger in Bodhi brimming. And I felt my own pulse quicken. I could sense myself. My nostrils flared. My temperature was rising. I was ready to swing into action and do something about this. And then I remembered the article. To be very clear, this part was not easy. Old habits are really hard to break. But I forced myself in that moment to pause and ask the single question. Do you want to be helped, heard, or hugged? And guess what? Bodhi, our morning cuddler, guess what he wanted? He wanted to know that someone was looking out for him, that even though his brother was making him feel small, that I still believed in him, that my love for him was safe, secure, undiminished. And even now, as I'm telling you this story, it truly breaks my heart to think of all of those moments when I had missed the chance to build him up, when all Bodhi wanted was a hug to feel safe again. Since discovering this simple question, helped, heard, or hugged, we've learned that it helps our whole family. It's become a shared reciprocal vocabulary in my home, a way of coming back to one another when we seem adrift and apart. My oldest will ask this question ironically, maybe a bit too sarcastically, really. Do we want to be hugged or helped? My youngest, our daughter, always wants a hug. And sometimes the kids will roll their eyes at us when we ask the question, but they still answer, which I'll count as a win. The question has helped us as a family find common ground when sometimes we lose our bearings with one another. All families have things like this. All families have things like this. Maybe it's a phrase, maybe it's a gesture, maybe it's a look. My sister lives across the country in California now, but I can tell even from the way she picks up the phone and says hello whether she's pissed at me. These rituals that we enjoy are a way of creating something. They're a way of creating a connection, building a shared vocabulary, finding relationship, making meaning together. And at a time when we are so often struggling to find connection, maybe there's a clue in these small acts that have helped tribes and families and friends for generations. Every year when I sit down to write for this moment, for this podium and this forum, I always find myself thinking about the mechanics of what we do in this community. That's probably a weird thing to think about, but I do. Together as a community, we do something really important. We discover powerful ideas for change. We test those ideas, we adjust them, and then we try again. Fundamentally, the work of improving, our work as a community, is about learning. And learning is how we manage to change and how we manage through change. With each of the prior keynotes I've given from this stage, I've asked something of this community. I've asked something of all of you. I've asked you to find the biggest challenges that face you and your health systems of caring. I've asked you to listen to what's happening around you, adjust what you do, and apply your skills of managing change to the new problems that threaten human health and challenge our health systems. 5 years ago, I spoke to you about the demographic transition that was afoot and upon us, and the need for an age-friendly health system. I asked you to apply your talents to improving care for older adults, and today, 4.6 million older adults receive age-friendly care in over 4,800 health systems because of your work. In 2020, with the pandemic raging and the Black Lives Matter movement pushing for recognition of what matters to marginalized and overlooked communities, we here at IHI asked you all in this community to apply your skills in quality improvement to reduce health inequities. Again, this community rose to the challenge, forging the Rise to Health Coalition, which has now reached nearly 1,000 health systems across this country. And in more recent years, with misinformation proliferating, polarization at all-time highs, and trust in medicine at all-time lows, I asked you to use your skills to build trust and connection with one another. And last year, with epidemic rates of burnout and moral injury in healthcare, I asked you to use the skills of modern quality improvement to find your own joy in work and reconnect to your inner purpose. You did that and much, much more. You built something that's quite extraordinary, a technology-enabled operating system that embeds better and safer care into our health systems and does so by restoring humanity to the work of giving and receiving care. Today, when I look out on the horizon, I think there are three phenomena that are informing my thinking about what might come next. First, we have widely divergent views of what would make us healthier, safer, and kinder to each other. This has been true for a long time, forever really, but with the passing of time and a retreat to our own echo chambers, we are becoming more and more disconnected from one another, finding it harder and harder to hear each other. Ernest Hemingway once asked, "How do you go bankrupt?" 2 ways, slowly and then all of a sudden. We have perhaps been drifting apart gradually, but we now find ourselves suddenly living on 2 completely different islands. Second, I see a sharp rise in a toxic form of individualism. Individualism that is coming at the expense of our communities. Here in the US, we have always prized the spirit and efficacy of the individual, but we have nuanced that view with an earnest belief in our communities, trusting our neighbors to look after our homes, care for our children, bear our secrets. Holding these two in balance and in continuous contradiction has been uniquely and amazingly American. I can believe in both the rugged individual who builds a corporate empire and in the virtue of public education that's free for everyone. But lately I feel the balance has been tilting towards individualism at the expense of communitarian values. I succeed in spite of my community. What matters to me is what matters most of all. Lastly, I've noticed something happening in this community of improvers. Perhaps it's been a reaction to the toxic individualism and polarization that grips our societies that I just described. But within our community, the community of improvers that's all around us here today, we have leaned hard into deepening human relationships. At forums like this one, all over the world, there has been an unofficial track in the program, featuring sessions on kindness, community, connection, compassion, a steady, persistent undercurrent about leaning into human relationship. Perhaps we should make that into a formal track at the program. In many ways, this unique combination of sentiment and science has been part of IHI's DNA from the very beginning. But I think it really took off when IHI's former president, Maureen Bizignano, spoke from this stage, inviting all of us to ask our patients about what matters to them instead of focusing on what was the matter with them. This simple adjustment, this simple pivot, began a global conversation about compassion, empathy, co-production, and co-design. Keynotes on kindness, overflow sessions on co-production, couch conversations about restoring trust and belonging. Maureen had unleashed a beautiful torrent of energy focused on cultivating relationships and creating connections between and amongst people. These ideas, in my view, were an antidote to the divergence and the unchecked individualism that was all around us. They have been an affirmation of the values of togetherness and community. And if I'm totally honest with all of you, they have been a comfort to me over these past many years. I, like so many of you, needed this recentering on the humanism that is at the core of what we do in healthcare. But even as I say this, I have wondered about how these ideas connected to our work in the world of quality improvement. It wasn't the science of these concepts that bothered me, which many scholars have studied now and demonstrated previously. There are gold standard studies, meta-analysis and reviews, showing the value of kindness, co-production, and compassion. But for me, these ideas have always felt a bit separate, a bit apart, a bit distinct, tacked on to the edges of our work in improvement. Nice to have, but perhaps not at the center of what we were doing. They were rarely subjected to the technical sciences of improvement, studies of variation and system change, that we have used to make care safer, more timely, more reliable, more patient-centered. And then I heard my friend and colleague Tom Lee describe a concept that landed these ideas for me. I don't want to steal his thunder. He's backstage. He's going to get angry at me if I steal his thunder. But in just a few minutes, Tom's going to come up here. And he's going to introduce you to the idea, the concept of social capital in healthcare, and how all of us can become managers of that social capital in our systems, in our teams, and even within ourselves. The idea of social capital is not new. The concept has its roots in 19th century social science, and it's been studied and discussed ever since. But Robert Putnam, some of you will know, a Harvard political scientist, renewed interest in social capital in his book, Bowling Alone, when he noticed that more and more Americans in the second half of the 20th century were not spending as much time with their neighbors and in their communities. We were detaching, retracting, disconnecting, and we needed something to reconnect all of us. The idea of social capital is a way of understanding the human connections that bind us to one another. It's the unwritten rulebook of rituals and habits that allows families, tribes, and communities to connect and stay connected. It's baked into the question, do you need to be helped, heard, or hugged, which allowed my family to start connecting with one another again. Social capital links all the component parts we've been emphasizing here at the forum: kindness, compassion, joy, pride, belonging, trust, into a single, unifying, measurable, and improvable concept that I believe is our next horizon in healthcare quality. There are organizations that are in this audience here today, places like South Central Foundation in Alaska, Jönköping County in Sweden, Chickasaw Nation in Oklahoma, that have long understood that investing in relationship is the secret sauce of quality. It's no accident that those organizations outperform their neighbors by wide margins. They know that it is not enough to improve the individual technical elements of healthcare. We need to apply ourselves with the same rigor and responsibility to the task of improving the relationships that make that care possible. This is where we together as a community of improvers should go next. And to help take us there, please join me in welcoming Press Ganey's Chief Medical Officer and my dear friend and colleague, Dr. Tom Lee, to the forum stage.
Thanks so much. It's a thrill for me to follow Kedar, and I'm going to be picking up on some of the themes that he articulated, but to have a chance to talk to all of you. And I'm not going to be giving you new work. I'm not going to be giving a pep talk. It's really a framework for thinking about your work, how strategic it is for your organization, and how critical it is that we be effective and how to be effective. The argument I'm going to make is that every single manager and every single caregiver should see themselves as being like the CFO for social capital and approach it with the same intensity and discipline that CFOs approach to money, that you don't ignore where you're hemorrhaging social capital just the way the CFO would not ignore when they're hemorrhaging money. So I think that my goal and our goal is by the time we finish it, there'll be some specific takeaways for you that will resonate with your values and make you more effective in the years ahead. So let me see if I can advance this here. I'm pressing the green arrow, which usually works. Okay, there we go. So what does social capital look like? I know this is a term many of you know. Some of you is vaguer than for others. But there are lots of images that all of you will recognize where we know people are working together, they're functioning like teams. You know, when there are safety huddles, where, you know, people are getting together to talk about near misses and events. You know, when managers are rounding on the people reporting to them, checking in on them, trying to create the multi-layered relationships like the ones that Kedar discussed, you know, described for his family. You know, ultimately, ideally, we have multi-layered relationships with the people we work with. You know, and when you have those good relationships on a team, you have colleagues who say yes without needing to know the details. I mean, that's a specific goal that I would be encouraging you to be going after on your teams. We've all been on teams where everything has to be negotiated, and we know how dysfunctional that is. You want to be having a context where people will say yes without needing to know the details. Now, all of those images are lovely, but really getting stronger, not just accepting them and being grateful when they happen, but building those, that takes work and discipline. And so that's why in the middle of the slide, I say that, you know, okay, everyone in healthcare has lovely values. Every single person in this 3,000, person-filled room has wonderful values. The tough part is these two questions. What are going to be the norms, the behavioral norms that we are going to adopt in our organization in order that reflect those values? And the next question will be like, what are the enforcement mechanisms to make those norms happen all the time so that we actually can increase performance? Those are more difficult questions, but if we're going to really pursue our values and be who we want to be, we've got to be ready to take on those questions. And so, you know, the examples of that I'll give for you is that there are a number of organizations today that are actually working toward the goal of, we're going to make respect like hand hygiene. We're going to try to treat every patient and every colleague with respect. The people who are ignored, who no one ever talks to them, the people doing escort service and housekeeping and so on, we are going to treat everyone with respect. This doesn't take money, it takes social capital. An example of enforcement mechanism that I'll bring up is the point about at the Mayo Clinic, I'm sure there are a lot of people here who've worked at the Mayo Clinic, and you can test whether I'm accurate here. I know I'm accurate, that there is a long-standing behavioral norm at the Mayo Clinic that you answer your beeper immediately if it's a clinician calling a clinician about a patient. Their smartphones and their beepers give off a different kind of signal when it's a clinician calling a clinician about a patient. It can be a nurse calling a doctor about a patient not doing well. Radiologists at the Mayo Clinic don't like to recommend additional tests. At the end of the readings, they page the doctor and they talk to them, and they can do that because they know the other person will answer immediately, like within seconds. They don't drive to where they're going, they pull off the road. They don't finish a conversation or a meal, they answer. So I can tell you in most places, the Brigham where I practice, it's not like that. You know, you answer if you feel like. And the result is, no one pages, because who wants to hang around waiting for someone to answer? You write an email and maybe it gets answered that night. And that is clearly not as good as people working together in real time. And I didn't believe it when I heard that this was a norm at the Mayo Clinic. But when I went there for the first time, I asked, and it was true. And I saw it in action. And so I asked, what happens if you don't answer your beeper right away? You know, I felt a little bad asking that question, but I wanted to know. And the first person, I was there with a bunch of cardiologists. I was giving cardiology grand rounds. And the first one looked at his colleagues and said, the earth would open up and swallow you. and the second one said, you will be put out in the winter in the cold and you will die. And then third, Henry Ting, who had been my medical student and trained under me a few years behind me at the Brigham, he said, look, you just don't want people to say he's the kind of person who doesn't answer his page right away. So the enforcement mechanism was social. They valued their connection to each other so much that they couldn't imagine violating that. You cannot have financial enforcement mechanisms. They do not work. It's social. So that's why you need to build connections, the kind of multi-layered connections that Kedar was alluding to, in order to have norms have effect. I can tell you the Mayo Clinic, another one is you do not look at your smartphone when you're walking around where patients are because it's off-putting. That is a norm. I'm sure it's not a norm in most of your places. These norms ultimately have the effect of patients can trust their caregivers more, but you can't get there unless the caregivers are going to be ready to have norms that reflect their values. In order to do that and have them reliable, you need social capital. You need what was Kedar put up there were some standards for how people interact with each other and with their infrastructure that enables them to do things they couldn't otherwise do. Now, I have a book coming out at the end of January. That is my attempt to sort of bring these ideas of social capital from other fields to healthcare. Basically, it's not new ideas. It's sort of a framework for looking at them. There are currencies to social capital, like trust and teamwork and respect and high reliability. When I use the word currencies, yeah, I'm comparing them to money. And some people say, well, money is real, and these things are fuzzy. But when you think about it, like money isn't real. Money is an artificial construct that was created to lubricate interactions. I mean, if we had to barter for everything, everything would take forever. And but money makes transactions like I can exchange the value of 6 eggs for a hammer much more quickly than if I was bartering. Similarly, if you have trust and respect and teamwork, you can make decisions and get things done much more quickly. So think of these as currencies that you should be trying to build, and the more capital you have, whether it's money or social capital, the better. Capital is something that gives you an advantage, enabling you to be better than you otherwise would be. Social capital is most critical. This is what scholars who have written about it, when work and organizations are complex. If you've got a simple product and a simple organization, you can just have a boss telling someone what to do and make sure they're doing it. But when you're doing something complex, like every single person in this room does, and in organizations where there are inherently matrix responsibilities, then how trust and these lubricants become absolutely critical. I'd also say that we're in a time where financial capital and human capital are limited. We're doing the best we can in every organization on those things, but there are big limits on how many people we can hire and how much money is available. And what this means is that we have to hit it out of the park on social capital, how we work together. That is something that is very much under our control. I actually feel that social capital is more important than financial capital. I mean, I am not naive about business. I love money. I'm interested in money. But I think about that stuff all the time. But I can tell you, you can get money from the outside. No one can give you teamwork and trust. And when I've talked to CFOs about this, this line about I want every manager to be like CFO for social capital, the CFOs that love it, and several of them have said to me, first they want to make sure that we're being as disciplined as they are, but the more thoughtful ones have said, look, we know the limits of what money can do. Money cannot produce the things that we're talking about here. Okay, so how do you go about building social capital? There are two basic methods. Brokerage and closure. Brokerage, where you that's what we're doing here at this meeting. IHI is an information broker. You are expanding the idea of who you are. You are learning from people from all over the world. Closure is when you go back and you nail it down in your organization. They're doing this there. This is a better idea. We are all going to do this. That's going to happen for many separate, many individual things. But we are creating social capital here. And I'm going to come back to this brokerage and closure stuff in a little bit. Now, my book is heavily derived on the ideas of others. That really, there's nothing original here, and so I'm just sort of bringing it from some non-healthcare fields. And I'm not going to talk about these 5 different books. And these aren't the only 5 books that I've read in the last decade, although I can't think of any others right now. But they're great books by great authors, and the ideas are reflected from them. But I'm going to distill them down to a few insights. Okay, the one is, I think that you should think of this work as 3 basic functions for you. You've got to build connections among the people in your social network. You've got to strengthen those connections so that they're real and they're compelling, so that if people are deviating from the norms, they might feel like the earth will open up and swallow you. And then the third is you've got to transmit the right values across those connections. These are 3, intertwined but distinct types of work that in your roles as managers and caregivers that is helpful to think about. Now, the diagram on the right comes from a famous paper from the New England Journal of Medicine by Nicholas Christakis. I think some of you will recognize it. It's a social network. It's the Framingham epidemiologic study, where they do blood pressure and EKGs and everything every 2 years on people. And somewhere along the line, Nicholas started asking people, added questions like, who are your connections? And, so if I said, Kedar is a friend of mine, they would note that as a connection. And if Kedar said Tom Lee's a friend of mine, they would make that a strong connection. They probably wouldn't say, do you hug him, help him, or hear him? But,
We'll see how this goes, Tom.
That would be the next level down. And so what they found is that obesity spreads from person to person in the same patterns as infectious disease. So that, if a friend of yours gains weight, you are more likely to gain weight, even if you don't know that friend of a friend. And it actually goes out 3 degrees before the statistically significant effect falls off. And that's because norms develop around you that even when you're not aware of them. So last night at dinner, the dessert time came, and the first person said, no, I don't really want any dessert. And then the rest of us all said, no dessert. So. Yeah. I had to get M&M peanuts later on in the evening. But that's the way norms work. I'm sure many of you had the same experience. So, Nick Christakis, who did this work, he points out that, so we have to build connections and make the connections strong and compelling so that people don't want to lose them. And Nicholas points out that social networks are agnostic. They amplify signals. They can amplify good signals. They can amplify bad signals. They can amplify charitable giving and altruism and treating people with respect. They can also amplify racism and hatred. And one of the sad things that Nicholas and I were talking about this fall was that, unfortunately, bad things spread more easily and quickly than good things, which means we have to be really deliberate about spreading the good things that we want to spread. We can't just assume that they're going to spread. We have to work, and we have to be tough-minded and reliable about making sure that these norms, like everyone answers their page or everyone gets treated with respect, are happening, because we just can't assume that they will do it on their own. So that is one of the reasons why really strengthening connections is a critical part of the work. You cannot have strong connections if people don't feel proud to be in their organization, if they don't feel respected, if they don't feel included, if they don't feel that they're actually trusted. And the reason that you want people to feel this way is not to be nice. I mean, you do want to be nice, but the reason you want them to feel that way is because you want them to value the relationship so that the norms will have effect. Because you cannot do this with financial incentives. It has to be, people don't want to lose respect to their colleagues. The way you manage this kind of thing is you manage it. You ensure inclusion. You round on your employees the way you round on patients. You audit your own performance. There's a little article from Harvard Business Review that I excerpted in the book that's coming out, basically saying every Friday you should audit yourself, have a list of the people you report to, and answer questions on a yes/no basis. Where, did you have a meaningful interaction? Did you talk about the goals of the group? And did you talk about something personal so that, you can have the multi-layer relationships that Kedar, alluded to in his family description. It's important to do this in a tough-minded way because all of us are vulnerable to talking to the people that we like talking to and ignoring the ones who don't. And in any group, there are going to be people who feel like outsiders. You need them to feel like the norms apply to them. That's what reciprocity is about. You need everyone to be feeling things like, I'm going to say yes without needing to know the details. And Robert Putnam's very clear about this. He says, you're not doing this to be altruistic. You're not doing this because you're expecting to be paid back by the person. You're doing this because if everyone in the group has this norm, and then there are a lot of interactions among the people, it leads to a series of actions that make the group better. And you are better off because you are part of the group. So let me end in the sort of, how do you send good things across these social networks? I'm going to draw upon my own culture here. Kedar draws upon his, I get to draw upon mine. So I'm also born and raised here, but a child of immigrants. So this is a picture of Confucius, and I think many of you will know, some of you intimately will know, that Confucius was a Chinese philosopher who lived not quite 3,000 years ago. And he was a philosopher. It's like, philosophy about how do you try to be good? How do you try to be better than you currently are? And, Western philosophy, it tends to have a lot of rules in them. Like, Immanuel Kant, you should never lie even if it would save someone's life. Confucius was not so much into rules because he believed that life is complicated and it's hard to come up with a rule that's the right thing for every setting, just as the way it's hard to come up with a quality measure that's the right thing for every setting. But Confucius did believe in the power of rituals, where at these frequent, regularly occurring events, we behave as if we are the way we should be. And so, an older person stands up, comes into the room, you stand up as if you are respectful. A patient is lying in a bed, you sit down in a chair as if you are respectful. Someone from housekeeping comes on the floor, you say hello by their name, which you've learned, as if you're respectful, and you say thank you when they're done, as if you're respectful. Now, what Confucius believed is that if we behave with 100% reliability, as if we're the way we should be at these regularly occurring events, it hones our instincts so that we are more likely to be respectful, or whatever in the big gray zones that make up life in between. And Confucius also felt that if we do that, the beneficiary isn't necessarily the person to whom we've been respectful, that we are the beneficiary. We will feel more noble if we are behaving that way. And the way we can anchor it is by identifying the rituals, the norms that we want, and then really sticking with them. So getting tough-minded and disciplined and managing the same way we've learned, driven by IHI, how to be reliable about issues like safety, extending that to our social interactions. I think it's a critical success ingredient for our organizations in the future, and I also think it will be a great source of pride for us as individuals. So thanks so much for your time and attention, and now Kedar and I are going to chat about it.
Thank you, Tom. The tie is stronger. Not to worry, we can continue. Listen, we don't have a tremendous amount of time, but I do want to ask you a couple of quick questions. First of all, I wanted to get your thoughts on how, for the currencies of financial capital, human capital, there are clearly measurable ways of understanding those things. People, money.
Yeah.
For social capital, how do we measure it? Because for this community, especially to try to apply improvement methods to this challenge of creating social capital, how would you advise us to try to measure and understand this?
Well, and I think that it's much easier to talk about measuring social capital than understanding like cryptocurrency or Bitcoin. Because
Someday we'll have another talk about that.
yes.
When we both figure it out.
All right. We'll have to block out a day for that. But no, but like team culture, safety culture, that is a fantastic set of measures. It's not the whole story of social capital, but you're getting at very critical things. Our data from my colleagues at Prescana just showed that safety culture, has such a powerful driver of the engagement of the workforce. But there's, you can measure how respected people feel, both patients and the workforce, the teamwork, the alignment in the organization. You can get from patients how well they feel the communication's going. There's the trust, the likelihood of recommending. There's an array of measures, and I think that like someone managing a mutual fund portfolio, you've got to be looking at them and saying, and when there's a hemorrhage, you've got to address it.
When you see an organization with low social capital make choices about how to improve them, how does leadership behave in those organizations? What are they doing? What are they saying? How are they stimulating activities to try to drive improvements in social capital?
They are first saying they get it, and I'll give you two very quick examples how, like, in a very short period of time, leaders have led to big change through these discussions. One was, we got a bunch of people from Kings County, right back there, and they can testify. But like last February, I talked about social capital at our big annual meeting at Prescana, and the deputy chief nursing officer got into it, and she went back and she read about social capital, and then our talk was in February. At the end of March, she told all the nursing unit leaders, every nursing unit must have a plan for building social capital on their unit, and it's got to be implemented in July. And they talked about it, and they implemented, and even as they were just talking about it, their patient experience started to go up, and their workforce engagement was improving. And then when they implemented, the improvement continued. And so that when their patient experience, like nursing communication, that kind of stuff, has gone up and up. And when the Joint Commission came in, I think August, they said, the dynamics on the floors are really good, and they were pointing to, and the leaders, the nursing leaders, their CNO is right here, Opal, she'll tell you that they feel like it is the social capital work people feeling like they're working together. Wow. So this is like, it's not years, this was like weeks. And, and I would also say, go to like Sutter. Sutter today is a different organization than it was 3 years ago. Warner Thomas went there, and he gave a message that we're not just a big collection. What clinicians really care about, that is what the organization cares about. And in just 3 years, a whole bunch of things have changed, reflected by things like, the physician turnover rate is 2%, and 85% of the physicians answered their engagement survey, which is high. It's a measure of something. So this can change with leadership and management so much faster than people expect.
This is a community. We have a saying at IHI that I think you've heard before, but what can you do by next Tuesday?
Yeah.
And so this is a question. I'm curious. What would you advise this audience if you were trying to ask them if we could make one change, everybody in this room, just try to build social capital in their teams or in their organizations? What would you tell them to do by next Tuesday?
Well, I would actually imitate the Kings County example. And say, and at every unit, the organization, the real action does not happen in the C-suite. It's what happens at the front lines. And say, talk to all the managers and like, look, if Kings County can do this, we can do this. Yeah. In each of our units, we need you need to develop a social capital plan and begin discussing, how do we build the connections? How do we strengthen the connections? How do we make sure the values that we care about are being spread across those connections? I don't think that's hard to imagine.
Yeah. Well, Tom, if you ever page me, I will pick up my phone and answer the page. So thank you so much. Please join me in thanking Tom for this conversation. You stay there for me. Oh. So now you've heard it. Social capital is how people interact with each other to advance their goals. It's a ritual, it's habit, it's reciprocity, as Tom said. Social capital cannot be bought or sold. It has to be made. It has to be built by two or more people in a relationship. Social capital can't be imported, Tom has taught us, from an external source. It has to be created from within. There are practices and behaviors that build social capital, and there are ways to erode it, Tom has taught us. Each of us, Tom's helped us to understand, has the power to manage this kind of social capital in our teams and in our organizations. Each of us has the power to build social capital or to lose it. Social capital, as Tom is describing, is measurable and it's observable, and importantly, it's variable. You know you have it when you have it, and you can feel its absence, I think, when you don't. Teams that have high social capital just feel different, and they work different. Relationships with high social capital, even with pre-teenage sons like mine, work a little bit better than those where trust and respect are being second-guessed. The properties of social capital, its observability, measurability, and variability, they'll sound familiar to improvement leaders like yourselves because they are part of what we do in improvement work. And I think social capital can be a new ambition for our work on quality, a new aim for us to apply our quality improvement knowledge and skills to, a way of linking the work that you see throughout this forum on kindness, compassion, trust, and belonging to what matters most to each of us and to our patients, families, and communities. Making the technical improvements that we do to any system and process will make things better for a short period, but improving the actual relationships within the team that makes those improvements will make them stick forever. I remember a few years ago, I heard the story, I think Don and Maureen might have told the story to me of Edis Donabedian's famous quote towards the end of his life, when he said, "Ultimately, the secret of quality is love." And I recall thinking that this was a nice idea, but sort of an oddly imprecise one from one of the guys that gave us the sort of study of evaluation in healthcare quality, the guy who gave us structure plus process equals outcome. So then I looked up the full quotation. What Donabedian said was systems awareness and systems design are important for health professionals, but they're not enough. They are enabling mechanisms only. It's the ethical dimensions of the individuals in the systems that are essential to success. Ultimately, the secret of quality is love. Donabedian was realizing towards the end of his life that the technical was not enough. It was the relationships within the systems, the social capital that Tom spoke about, that would matter most. Donabedian would go on to conclude, if you have love, you can then work backward to improve the system. Thank you all, and enjoy this incredible forum.
So,
Appreciate it.